Have you ever heard about pleurisy? It's a medical condition that affects the thin lining of the lungs and chest cavity known as the pleura. When the pleura becomes inflamed, the two layers of it rub against each other during breathing, causing sharp chest pain. Pleurisy can be triggered by various factors, including infections, autoimmune diseases, and injury to the chest. What makes you more susceptible to pleurisy? Well, infections like the flu or pneumonia, autoimmune diseases such as rheumatoid arthritis, lupus, and Sjögren syndrome, lung conditions including pulmonary embolism, lung cancer, and pleural mesothelioma, and chest trauma can all increase your risk. So how would you know if you have pleurisy? The most prominent symptom is sharp, stabbing chest pain that worsens when you breathe deeply, cough, or sneeze. This pain is often localized to one side of the chest. You might also adopt shallow breathing patterns, have a dry cough, experience shortness of breath, and in cases where an underlying infection is the cause, you may develop a fever. Treatment for pleurisy involves addressing the underlying cause, whether that's with antibiotics, antiviral medications, or anti-inflammatory drugs. Pain management is also crucial, as is rest and recovery. In some cases, surgical interventions may be necessary. Prevention is always better than cure. Maintain good respiratory hygiene, get vaccinated against respiratory infections, practice safety measures to prevent chest injuries, and manage any underlying conditions. In summary, pleurisy is a condition that affects the lining of the lungs and chest cavity, causing sharp chest pain. Its risk factors range from infections to autoimmune diseases and chest trauma. While it can cause discomfort, with timely diagnosis and appropriate treatment, it can be managed effectively. Remember, prevention is key, so take care of your respiratory health. Remember, knowledge is power. The more we understand about conditions like pleurisy, the better equipped we are to prevent, recognize, and manage them. Let's delve deeper into our conclusion. Pleurisy is not just an ordinary condition. It's a serious one that requires immediate medical attention. The piercing chest pain it causes is more than just discomfort. It's a cry for help from your body. Understanding its risk factors and symptoms is not just for knowledge's sake, but a tool for early detection and prompt treatment. Speaking of treatment, it goes beyond just popping pills. It involves addressing the underlying cause, be it an infection, autoimmune disease, or chest trauma, and managing the symptoms to provide relief. Prevention is not just a buzzword, it's a strategy. It includes maintaining good respiratory hygiene, getting vaccinated against respiratory infections, and managing underlying conditions effectively. So it's not just about understanding pleurisy, it's about equipping ourselves with the right knowledge and precautions to prevent and manage conditions like pleurisy.